Well, hello, and welcome to the video on our GI drugs. This video will be discussing the drugs that were covered in your chapters 58 and 59. So first I want to talk about laxatives. So there's many different reasons why patients have a full colon and need to empty that colon, whether they're constipated or whether they're having a GI test, such as a colonoscopy, or variety of different reasons why we need to get that poop out of the patient. There's lots of different medications that are available, and it can be confusing for the patient and for the nurse to know which type of medication you're going to use for which different scenarios. So try and focus your attention on why you would be using some of these different medications. Number one, how they work, but then more importantly, when would you use them and what kind of adverse effects would you be possibly seeing with that? When we talk about laxative, we're talking about the short-term relief of constipation to prevent straining even after surgery or after having a baby. We don't want the patient straining to have a bowel movement, so we may administer a laxative. Whatever it is, it's going to evacuate that bowel. You should know that certain laxatives can cause dependence. So we want to educate our patients on if they're using the laxatives too much, it can create a dependence. So the first category is the laxatives, and that is two medications that are on your list. One is the bulk stimulant, which is magnesium citrate, and the other laxative is a lubricant, which can be bought over the counter called mineral oil. Mineral oil is used for other things. This is the same old mineral oil. We just give it to patients with a teaspoon. The other type of medication to evacuate the bowel is the GI stimulant, which is metoclopramide. So the first one, the bulk stimulant, magnesium citrate, it's a fairly rapid acting laxative, although magnesium citrate is a milder and slower laxative than some of the other ones. Some of the other drugs that you may recognize in this category of bulk stimulants are Miralax, which you can buy over the counter, which we prescribe very often for patients. It's a colorless, odorless powder that can be given and creates a bowel movement within 24 hours. And we keep patients on this pretty regularly to maintain their good, soft stools. Also, Go Lightly we use for procedures, milk of magnesia, Metamucil, right? It bulks up the stool. It's very important that when you're giving a bulk forming laxative that you encourage patients to make sure that they're having enough fluids with that. Now, if they are going to be having a surgery, then they might be NPO. So we need to be very careful about which laxative we're using. If a patient is having a GI test, like a colonoscopy, they don't have to refrain from drinking water. So we want to make sure, pens up, that when you are giving patients a bulk stimulant for their laxative, that they increase their water with this. It is taken orally. It is contraindicated, and how would you think that that would impact the patient? Well, if they're in acute abdominal distress, if they have just an acute, what we call it an acute abdomen, this would be like an appendicitis. That would be contraindicated. We would not want to give the patient this because that can further exacerbate the inflammation and problems depending on where the problem is in the acute abdomen. So be careful. You want to assess your patient before you're giving this to see why are they having stomach pain. Don't just assume that it's constipation. Although constipation, we know, is one of the #1 reasons why people go to the emergency department with stomach pain. But you have to be very careful. And so what we're doing is we are speeding up the evacuation of the bowel. So what do you think the adverse effect would be? Too much action, going through too fast. The bowel's going through too fast. So diarrhea, exactly. The other lubricant medication that we use is mineral oil. And what that does is it just makes defecation easier. It's not stimulating the GI tract. It's just kind of forming this slimy coat on the poop and helps it come out easier. So it's another short-term treatment for constipation. An example of a case study would be a patient who's having a couple episodes of hard stools in, say, a month's time, and they need to just have a short-term fix for this constipation they're having. So I'm going to give them this lubricant, which is going to make it easier to have a bowel movement. Other medications in this category are docusate sodium, Colace, you may recognize that, or glycerin, a glycerin suppository. Again, it just kind of slimes up that stool and helps it slide out a little bit easier. And again, side effects to this would be diarrhea. It's coming out too fast. And then also with mineral oil specifically, it can decrease the fat-soluble vitamin absorption, A, D, E, and K. So a GI stimulant that we could possibly use for patients would be metoclopramide. And this works differently than those laxatives, where it's actually stimulating the parasympathetic activity within the GI tract. So it stimulates that gastric emptying. So why would we use this? Are we going to be using this in the same way we would use the other ones? Well, we definitely would be using this metoclopramide for patients that have decreased stomach emptying, such as gastroparesis. Patients that have diabetes are at risk of getting chronic diabetic gastroparesis, where their stomach is just not emptying. It's a problem with the nerves. Remember, diabetes can cause problems with all the blood vessels. You have blood vessels throughout your body and also all the nerves. So can cause problems like this gastroparesis. So the adverse effects of this, again, it is stimulating that parasympathetic activity within the GI tract. So you remember what the parasympathetic does, right? So they're going to be having more drowsiness. That's moving that stool through faster, and it can cause diarrhea. That rest and digest, and it can cause fatigue. When would we want to be cautious about using this medication? Again, if the patient has an acute abdomen, if they have intestinal obstruction, if they have bleeding, we want to make sure we are listening to bowel sounds before we are administering this. And if the patient is on digoxin, we know that that can be something that we really need to be careful of, because using this medication can decrease the absorption of digoxin. Now, the opposite of these medications, what if you have a patient whose bowels are going through too fast and they have diarrhea? So you need to slow things down. You might want to administer an anti-diarrheal medication. This slows the motility of the GI tract. And this medication that's on your list is called loperamide, and that acts through direct action on the muscles in the GI tract. And it is used as treatment for nonspecific diarrhea, like traveler's diarrhea, irritable bowel syndrome, so just nonspecific diarrheas as well. So if we are treating a patient that bowels are moving through too quickly, we're slowing that down. What would an adverse effect be? Too slow. Constipation. You got it. So our patient teaching for this, definitely we want to make sure that we're monitoring that patient's fluid status if they have diarrhea. So we're assessing that before they start taking this medication. And we're telling patients to take one of these medication tablets after each unformed stool. So if they have a big diarrhea stool, then they would take that medication. So whenever you have a patient that has alteration in their GI functioning, whether it's constipation or diarrhea, make sure, pens up, that you are monitoring their fluid, their electrolyte status, listening to their bowel sounds, palpating their abdomen, making sure what you have as an assessment before you administer these medications. And then your response, the patient's response to the medications after you administer them. That's it. Thanks.